Coming for therapy might be quite anxiety provoking when you don't know what to expect. So let me help alleviate some of that by telling you about what happens at each step of the way when you come to GetCBT. My name's Victoria Lacey, Principal Psychotherapist at GetCBT. So many people first contact us for a free consultation. This is such a good opportunity for us to get to know you. We can introduce ourselves and of course answer any specific questions you have. And if you're willing to tell us a little bit about what you're experiencing, then sometimes we can make suggestions about what therapy might be worth exploring. We offer cognitive behavioural therapy, acceptance and commitment therapy, compassion focused therapy, and EMDR. So what happens after this? Well, if you decide that now is the right time for therapy and that your therapist is the person you want to work with, then we'll send you a therapy agreement. This therapy agreement tells you lots more about what you can expect from your therapy, our code of conduct, and things like how to go about booking and cancelling appointments. Once you've signed the therapy agreement, you will get a link asking you to register on our clinical information system, which you can use to manage your appointments and also complete some helpful questionnaires. So let me tell you a bit about your first session. If you've arranged a virtual meeting, then you will receive a Zoom link prior to your session. If you've opted to come into our clinic, then our receptionist will be ready to welcome you at the door and show you to our waiting room. We will look forward to greeting you on the day and time agreed. So at this initial meeting, we work together to identify the problem or issue that you want help with. We will try and ask you about the problem, how it troubles you, about how and when it might have started, as well as any other treatment or support that you've had in the past or are having now. And this can take 1 or 2 meetings. At the end of this period, the assessment, we will agree on your goals for therapy. So what next? Well, your therapist will initially offer you a specific number of sessions, and that's usually about 8 to 16, but it can vary depending on your problem, how severe it is, and how long you've been experiencing it for. Of course, we can revise this together to have more or fewer sessions, and we'll routinely review your progress every 4 sessions. You can end therapy at any point without further cost. So sessions usually last for about 50 minutes. Sometimes it's clinically useful to have longer or shorter sessions, and we can discuss that if relevant. While treatment usually happens online or in our clinic, sometimes it might be useful to leave the clinic or continue our online treatment outside or in other locations as part of our work together. Your therapist will always discuss this with you first, but ultimately, it's your choice. So how do we come to an end? Your therapist will discuss your progress regularly, and you should be aware when we approach the end of treatment. Before we end, we'll discuss how to maintain progress or prevent relapse and any other professional help or support that might be useful. We really hope you found this video informative, but of course, if you have any specific questions at any step of the way, then we're here to help. If you'd like to learn more about how to prepare for your therapy or the different treatments that we offer, then please check out our other videos.